Oxygen therapy. Pulse oximetry measures the oxygen level in the blood, or the oxygen saturation. It's a simple, non-painful way to see how well oxygen gets into the body's farthest reaches, like the arms and legs. Pulse oximeters measure how saturated each red blood cell is with oxygen as it passes through the light in the monitor. The monitor shines a light at a certain wavelength through the finger, and then it measures the wavelength on the other side. Different wavelengths indicate different saturations. It doesn't matter if 10 red blood cells pass through or 1,000. The pulse ox will read the same saturation. For example, an anemic patient with low blood levels will still have a normal pulse ox. How to use a pulse oximeter. Place the pulse ox on the patient's finger. The screen will display a number that represents the oxygen saturation of the red blood cells. It will usually also display a pulse rate. To ensure you're getting a good reading, make sure the pulse you feel at the wrist is the same that is displayed on the monitor. If the fingers are very cold or if your client has poor circulation, the pulse ox may not work. For most people, our normal reading will be above 92%. Some people with chronic conditions will have a lower normal. Make sure you check your client's file to know what level their oxygen saturations should be. One of the main treatments for respiratory conditions is oxygen therapy. Our bodies require oxygen to function properly, and it is needed to create energy in the cells. Respiratory conditions can cause low oxygen levels in the blood. A client with low blood oxygen may feel tired, short of breath, or confused, and it can also cause damage to the body. Oxygen therapy can help the client get more oxygen and feel better. Oxygen therapy is something that must be prescribed by the doctor. Sometimes it's only needed for a short period of time, and other times it will be for long-term therapy. Some people require oxygen all the time, where others only need it at night or if they're out and about. Some conditions that may require oxygen therapy are COPD, pneumonia, COVID-19, severe asthma attack, late-stage heart failure, cystic fibrosis, or sleep apnea. Oxygen can be delivered to the client through a variety of devices. Through a liquid oxygen tank, a gas oxygen tank, or an oxygen concentrator, which pulls oxygen out of the air. Oxygen is delivered to the client through nasal cannula or tubes that go in the nose, a mask that fits over the face, or a face tent that fits around the face and covers the lower half of the face. Oxygen therapy is generally safe. It must be given at a prescribed rate in liters per minute. You should not increase or decrease it without first speaking to your supervisor. Side effects of using oxygen include a dry nose, frequent nosebleeds, fatigue, and headaches in the morning. While oxygen is not flammable, it can cause other materials to burn or ignite more easily, resulting in an explosive-like ball of fire. If your client smokes, they must never do so while wearing oxygen. People have been severely injured and even killed by smoking with oxygen on. Similarly, no one should smoke in the house when someone is using oxygen. If the client uses tanks, be very careful with them. Ensure the tank is secured and stays upright. If the tank were to crack, or if the top were to break off the tank, it can fly like a missile. Make sure you know how to turn off your client's oxygen in case of emergency. Here are some general safety guidelines for oxygen therapy. Post no smoking and oxygen in use signs. Remove fire hazards from the home, including cigarettes, cigars, space heaters, and flammable liquids. Advise your client not to use candles. Have flashlights and lanterns ready in the case of a power outage. Advise the client to avoid using fireplaces, lighters, and gas stoves while wearing their oxygen. Do not use an extension cord with an oxygen concentrator. Avoid flammable fabrics such as nylon or wool that can cause static electricity. Never use Vaseline or petroleum-based products as they can be a fire hazard. Monitor your client's pulse, respirations, and oxygen saturations before and after the client uses an oxygen tank, and document any changes. The humidifying bottle should be filled with distilled water and washed according to directions with an appropriate and approved cleaner. Compare the concentrator's flow rate with what is prescribed by the treatment plan by observing and documenting the flow meter that the concentrator is set at. Ensure that the tank is secured and won't topple over. Always have a full spare tank ready to go. When ordered, change the nasal cannula. It should be changed at least every 2 weeks or when it becomes hard or cracked, or if the client is sick with a cold or flu. When using liquid oxygen reservoirs, when the reservoir is not in use, turn off the supply valves. The reservoir should not be tipped on its side. Keep the reservoir out of closets, cupboards, or other enclosed spaces. Linens and blankets should not be placed over the reservoir. Never roll or walk the reservoir. Always lift it with 2 hands. The equipment should not be touched if it is frosted, as it can cause frostbite. When using oxygen concentrators, the oxygen dials must be set according to the care plan. Ensure the humidifying bottle, if prescribed, is fashioned correctly after each use. Minerals can clog the tube, so always use distilled water. Place the concentrator away from the wall and ensure that it is well ventilated. Keep the air filters clean by brushing them off daily.